Welcome, my name is Tim DeBona and we are starting off a new pediatric group at 1524 Turnpike Street in Stoughton, Massachusetts. You know what we're doing, Jaden?
Yes, you're opening up a new practice.
A big group pediatric practice for the Stoughton community. We're kind of close to the Randolph movie theater and there's a Dunkin' Donuts inside, which means I imagine, what should we do, like munchkins for life for whoever goes there?
Yeah, sure.
Is that good for the health of our kids?
Or coffee? Oh wait.
Coffee, yes, definitely coffee. So I'm sure we're gonna have a lot of fun things when we get everything all started up. We're gonna have 6 medical providers there to do normal general pediatric type of medicine. We're gonna have telemedicine options so that if you have something that's very simple to get through, such as you wake up in the morning, your son has a rash on his arm and you don't feel like missing a day of work for this, going to the doctor's office, the kids miss school and stuff like that. Well, now we can set up maybe a telehealth appointment for you and we can take a look at it, figure out what needs to be done, call in the prescription. So on your way to work, you pick it up, you drop your kids off at school, you make your way back to work, nothing's lost. We want to just really improve the way that medicine is done because as a parent of 2 girls, I have a million things that I hate about the practice of pediatric medicine. And so my partner and I are going to really tackle all of these things. Like, we're gonna make it so you don't have to go be sent out to all these different places to get labs done. We're gonna do everything in-house. We have a very comprehensive lab internally. We are gonna have counselors doing mental health management. So most doctors get about like 4 to 8 hours of education on the mental health process. So pediatricians typically are ill-equipped to be able to diagnose mental health issues. So how anxiety presents in a 4-year-old versus a 14-year-old, they don't have the tools to actually figure out that this may be a good mental health consult. So we are going to have our counselors who also work inside our clinic. They are going to be educating our doctors on a bi-weekly basis. They're going to sit down with them in a room, provide case studies, and so that our doctors are all going to get educated on how to determine if maybe somebody has an eating disorder, or there's some survival guilt, or there's some type of panic attack, type of anxiety type of situation. All sorts of different mental health issues, or maybe there's a separation in the family, it's a blended family, or whatever the other kind of issues that something is not typically going to be picked up on. We're going to figure it out now. So all the people who you knew that turned 30 or 40 years old, they're like, God, I should have, when I was 8, seen somebody or said something. Now we're going to be able to find things earlier, get these kids into treatment, not have to wait 4 to 6 months like everybody's doing right now, because we're going to have the counselors in-house. So it's immediate handoffs. Your child will be able to get the counseling that they need, with just really as long as it's needed to provide the tools to help them be able to understand what their condition is and how to best deal with it. So we're really excited about this. We're going to get amazing outcomes. We're going to be very excited to talk about it, become a big part of the Stoughton community. We're right near the Randolph line. We'll be certainly servicing a lot of patients from the Brockton area, Avon, Canton, Sharon, Easton, and we're right next to 24, 95, and 93. So even people who come from further away, if they live somewhat close to a highway, they'll be able to make the drive over because we are right off the highway. It's easy to get to, and we cannot wait to see you there. We have construction underway, and we're looking to get started in the June-July timeline. So very excited to become part of the Stoughton community.
Looking back on it all.